So hello, my name is Charles. I'm a medical student. I'm doing a series of multiple mini interview stations. 6 a.m. flex, but I'm tryna get through to you. Diff time zones, but I'm tryna get through to you. Mama with the pressure, but I'm tryna get through to you. Tryna get through to you. At them, got me in my feelings when I think about you. And this what happened when I think about you. Got flashbacks tryna take me back to you. Damn. So today's station is an ethical station. I will be analysing how you break down an ethical station. Either record yourself saying what you would actually say in the station, or you can write down the points that you would make, or you can do it with a friend and get them to give you tips, and then afterwards you can listen to my breakdown of the station and what I think you should do or add to what you are currently doing. You are a medical student running late for your final exam. So one of the 4 pillars of ethics is autonomy, which means the patient gets to do what they want or act in their own interest, and you have to respect their decisions, and your role as a doctor is shared decision making and to facilitate that for the patient to be able to get their wishes across as to what they want where reasonable. Beneficence is obviously you have to act in the best interest of the patient as a doctor. Non-Maleficence means you can't cause no harm to the patient. Beneficence and non-maleficence, they work together. You can't do one without doing the other. And injustice is to do with obeying the law and also doing what's seen as socially beneficial or socially correct in that society as well. Moving on to our ethical dilemma that we have faced with. So first and foremost, when you start a station like this, I would acknowledge this is a difficult dilemma at hand. Of course, on one side you've got this patient, and if you walk away from this situation, this patient could potentially be fatal for them. A life is always important. On the other hand, you've got your studies, which are also important. If you don't pass medical school, or if you don't progress, you're not going to be able to be a doctor. Not being able to be a doctor will have implications in the future that you can't save more lives in the future. But obviously, weighing those, the conclusion that you're going to come up with is you're going to say one of the 4 pillars of ethics is beneficence. You always have to act in the best interest of a patient. You walking away, you are not acting in the best interest of this person who's in front of you. You're acting in your own best interest to better yourself, and it would defy the purposes of you actually wanting to do medicine, because you want to do medicine because you want to save lives. This is a perfect example of doing it. And I would currently tackle this situation, and then after I'd tackled the situation, then I would consider how I would tackle not getting kicked out of medical school by either providing evidence of what I had done. So in this situation, how you'd handle this situation, your doctor A, B, C, D. So first of all, you're going to check for danger. You're going to make sure you're not putting yourself at danger. There's no danger around you. Any glass, any needles, anything on the floor, puddle. To make sure that you're not in danger, you're not going to harm yourself. And the next thing you're going to do is you're going to check this person, are they responsive or not? So you're going to go up to them, can you hear me? Are they unconscious? Are they conscious? Are they breathing? If they're not breathing, they're not responding to you. You're going to call for help and make sure somebody comes. And then the next steps that you do just depends on your competency. If you've been trained to do life support, then you're going to start the chest compressions, and then make sure you call for an ambulance and get them to come through and try and take this person to hospital. Things to avoid to say is you're going to move this patient if they're unconscious, if they've bumped their head, because you're not experienced to be moving anybody. Or if they're not breathing, don't say you're going to do a tracheostomy and put a hole in the throat to try and help them breathe if you've not had training. Basically, do not say you would do anything that you're not competent to do. Stick with what you're competent to do. Make sure you call an ambulance, make sure they come. The reason why you wouldn't do anything that you're not competent as is because you can put the patient in danger or at harm, and that would define non-maleficence. And in this situation, if somebody nearby comes, get them to call an ambulance, say exactly where you are. You've got an unconscious male who's bumped his head, who's currently bleeding. If that's the case, tell them you need an ambulance very quickly. And then afterwards, when the ambulances came, the situation has been dealt with, you can ask maybe one of the paramedics that actually vouch for you and say you were there at that moment in time. And then you can also call your medical school to say what happened. I think these people are reasonable. There's evidence that you were there. The paramedic can vouch for you to say you were there. If you explain the situation, you're on your last warning and you just need them to help you to say you were actually there. Just to summarize, top things to do at all times: recognize your limitations in this situation. situation. Make sure you ask for help very quickly and you stick within your competence. And also by the end, just saying simple statements like, I got into medicine, I attend medical school for me to be able to help patients, and this is exactly a situation of why I am in medical school. My primary concern at this moment in time would be this person who's unconscious, and then afterwards I would try to convince my dean, by either getting the paramedics to phone in or getting someone who was there to vouch for you. That is always good, and that's how you should handle the case. Things to avoid to do is to say you'd use a smartphone to record the event to actually say you were there, because obviously it's confidentiality that you're now breaching. It's a good idea in principle, but obviously recording someone who's unwell and then using it to better yourself or to save yourself from getting in trouble without their permission, it's not good practice, so I would avoid that.
You never said bye, was subliminal. I was never in your plans, it was intentional. But it what we took off, it was conventional. Hey, now you're international. No finger to the dial, but you never go. Do I ever, cause your mind gets never know. But I wonder